It's gonna make all the beer taste bad.
It does. It doesn't take. Hello everybody, welcome to our channel, and this is our midweek check-in with J&J House Call. My name is Dr. John Lucio. I practice integrative medicine and pain management in Jefferson City, Missouri, and this is my wife.
It's nice to meet you.
Nice meeting you too. Today we're going to be talking about...
I get to introduce myself. I'm Dr. Jennifer Sue. I practice conventional gynecology and integrative medicine.
Today we're going to talk about an electrolyte that we have in our body. It's called magnesium, and I'm talking about this now because not many people hear about it, and but when I first bring it up to them, it's like the first time they've ever heard about it. Magnesium is an electrolyte that's usually inside the red blood cell, and so oftentimes if you get it measured through normal blood tests, you probably won't get an accurate level. So yeah, oftentimes I'll base it on patient symptoms. And it's unusual to really have a magnesium deficiency unless it goes along with some other things as well, because typically if you get a magnesium deficiency, it's due to some other problem that you have, and it's probably manifested in other deficiencies as well. So it's hard to really tease out what specifically is coming from, or what symptoms are due to the magnesium deficiency. But typically if it's just magnesium deficiency, people start to experience some twitching, and they can have some convulsions, muscle weakness as well, and some tremors. Some of the most common cause are really with people that have chronic diarrhea, celiac disease, some malabsorptive type syndromes. Diabetics can also have it as well. People that are on chronic proton pump inhibitors such as omeprazole and Acifex are prone to getting low magnesium. And so when I see patients in my office, and I'll start asking them some of the questions about, what symptoms they have. And oftentimes magnesium is used to help treat certain chronic pain conditions. It's a natural muscle relaxant, so it can be used in menstrual pain. I use it sometimes with people that have kind of overall body tightness, or they have fibromyalgia. Sometimes I'll prescribe that just at night. It actually helps people with migraines as well, helps decrease the frequency. It doesn't necessarily cure the migraines, but it can help decrease the frequency.
Menstrual migraines too.
Yeah. And so it's very, very effective for that. Other uses are, it actually can decrease the incidence of cardiac arrhythmia, so that it is an abnormal beat in the rhythm of the heart itself. Now, when you are looking to replace magnesium, unless you have chronic constipation, you really should pick other forms of magnesium other than magnesium citrate. Now, in my practice, oftentimes if I have patients who are on low-dose narcotics, they're chronically constipated from that, or they're constipated from something else, I'll actually prescribe it to be given just one at night. It's like, as I mentioned, it's a natural muscle relaxant, also helps with their sleep. But if they don't have that issue, magnesium citrate actually can cause quite a bit of distressing diarrhea. And so I give them magnesium glycinate or magnesium chloride or gluconate, which are other forms of magnesium as well. And they're just as effective. As I mentioned, the typical dose I start out with is around 500 milligrams at night. They take a pill form.
Whenever you first start on magnesium, expect your doctor to want you to start on just the lowest dose first, because seriously, your bowels will be loose and you will poop a lot and frequently, and it's a really loose stool. But it just takes your body, it took my body maybe 2 weeks, and after that, your bowels get back to normal, so then you're able to increase the dose, but increase it slowly unless you want an accident, because it will happen. It's just a normal side effect.
Yeah.
But like you said, if you're using it for like menstrual migraine headaches, you want to take about 200 milligrams twice a day around the time that you usually have a menstrual migraine headache. And you want the magnesium glycinate form, unless you're like his patients that have chronic constipation anyway, it might help with your constipation, but otherwise the glycinate has less GI, gastrointestinal side effects.
All right, well, that's it for today. Thank you for joining us. Next week, we'll be talking about
endometriosis.
Yep, I hope you can join us. And thank you for watching. So long.